Understanding obsessive-compulsive disorder, OCD, causes, signs, symptoms, and treatment. Obsessive-compulsive disorder, OCD, is a chronic mental health condition characterized by intrusive, unwanted thoughts, obsessions, and repetitive behaviors or mental acts, compulsions, aimed at reducing the anxiety caused by these obsessions. OCD can significantly interfere with daily activities and quality of life, but effective treatments are available. Here's an in-depth look at the causes, signs, symptoms, and treatment options for OCD. Causes of obsessive-compulsive disorder. 1. Genetic factors. Family history. A higher risk of developing OCD if there is a family history of the disorder. Genetic predisposition. Certain genetic variations may increase susceptibility to OCD. 2. Biological factors. Brain structure and function. Abnormalities in brain circuits involving the orbitofrontal cortex, anterior cingulate cortex, and basal ganglia. Neurotransmitter imbalance. Dysregulation of serotonin, dopamine, and glutamate neurotransmitters. 3. Psychological factors. Behavioral conditioning. Compulsive behaviors may develop as a way to alleviate anxiety or discomfort caused by obsessions. Cognitive patterns. Dysfunctional beliefs about harm, responsibility, and the need for control or perfection. 4. Environmental factors. Stress and trauma. Significant life stressors, traumatic events, or abuse may trigger or exacerbate OCD symptoms. Infection. Pediatric autoimmune neuropsychiatric disorders associated with streptococcal infections, PANDAS, can cause sudden onset OCD in children. 5. Developmental factors. Early childhood experiences. Childhood experiences, such as overprotective parenting or high expectations, may influence OCD development. Personality traits. Traits such as perfectionism, meticulousness, and high moral standards. Signs and symptoms. 1. Obsessions. Recurrent intrusive thoughts. Persistent, unwanted thoughts, urges, or images that cause significant distress or anxiety. Common themes. Contamination. Fear of germs or dirt. Harm. Fear of causing harm to oneself or others. Symmetry. Need for things to be orderly or symmetrical. Forbidden thoughts. Unacceptable or taboo thoughts related to sex, religion, or harm. 2. Compulsions. Repetitive behaviors or mental acts. Actions performed repeatedly to reduce the anxiety caused by obsessions. Examples. Washing. Excessive hand washing or cleaning. Checking. Repeatedly checking locks, appliances, or safety features. Counting. Counting items or steps to reduce anxiety. Orderliness. Arranging objects in a precise manner. Mental acts. Repeating phrases or prayers silently. 3. Emotional symptoms. Anxiety and distress. High levels of anxiety or distress associated with obsessions and compulsions. Shame or guilt. Feelings of embarrassment or guilt related to the nature of obsessions or compulsions. 4. Functional impairment. Impact on daily life. Obsessions and compulsions consume significant time, often interfering with work, social activities, or daily routines. Treatment. 1. Psychotherapy. Cognitive behavioral therapy, CBT. The most effective treatment, focusing on changing the patterns of thinking and behavior associated with OCD. Exposure and response prevention, ERP. A specific CBT technique that involves gradually exposing the individual to their fears and preventing the associated compulsive behavior. 2. Medication. Selective serotonin reuptake inhibitors, SSRIs, medications such as fluoxetine, Prozac, sertraline, Zoloft, and fluvoxamine, Luvox, that help increase serotonin levels, reducing OCD symptoms. Clomipramine, a tricyclic antidepressant effective for treating OCD, especially if SSRIs are not fully effective. Augmentation. In some cases, additional medications, such as antipsychotics, may be used to enhance the effect of SSRIs. 3. Self-help strategies. Mindfulness. Techniques such as mindfulness meditation to manage anxiety. Stress management. Practices like exercise, hobbies, and relaxation techniques to reduce overall stress levels. 4. Support groups. Peer support. Engaging in support groups to share experiences and coping strategies with others who have OCD. Family education. Educating family members about OCD to improve understanding and support. 5. Behavioral techniques. Habit reversal training. Identifying and modifying compulsive behaviors. Systematic desensitization. Gradually exposing individuals to feared situations while employing relaxation techniques to reduce anxiety. 6. Lifestyle changes. Healthy diet and exercise. Regular physical activity and a balanced diet to support mental health. Sleep hygiene. Ensuring quality sleep to help manage symptoms and overall well-being. 7. Advanced treatments. Deep brain stimulation, DBS. A surgical option for severe OCD that doesn't respond to other treatments, involving the implantation of electrodes to modulate brain activity. Transcranial magnetic stimulation, TMS. A non-invasive treatment using magnetic fields to stimulate nerve cells in the brain. Obsessive-Compulsive Disorder, OCD, involves persistent, intrusive thoughts and repetitive behaviors that can significantly impact an individual's daily life. Understanding the causes, recognizing the signs and symptoms, and exploring effective treatment options can help manage this challenging disorder. With proper therapy, medication, and self-care strategies, those with OCD can lead fulfilling lives and regain control over their symptoms.